With just one glance, autistic Tony noticed that the old doctor was pressing on the patient's airway during CPR. He quickly stepped forward and pointed out the mistake. But the old doctor saw he was just a young man and didn't want to listen. Tony continued, saying that if the patient were an adult, the position would be correct. But since it was a child, his hand needed to be placed above the wound, or it would block the airway. As he spoke, Tony adjusted the doctor's hand. Under the old doctor's shocked gaze, Tony placed his hand on the patient's chest. With just one touch, he diagnosed paradoxical chest movement. He immediately declared it was a severe lung rupture and that air had leaked into the chest cavity. If they waited even one more second, the patient could die. Without hesitation, Tony cut open the patient's chest. Then, using a few plastic tubes and a glass bottle, he built a simple one-way valve with his bare hands. The hospital director saw what he was doing and instantly understood Tony's intention. As the air was released from the patient's chest, the danger finally passed. While everyone cheered for him, Tony quietly turned and walked away. Watching his technique, the director realized Tony was an absolute genius. He immediately pulled every string he could to get Tony into his hospital. But what the director didn't expect was that Tony had already arrived to interview at the hospital. The department head saw that Tony was 10 minutes late and immediately said they didn't need doctors with no sense of time. Then he turned and walked off. But Tony wasn't ready to give up. He handed over his documents and introduced himself. But when the head heard Tony had autism, he mocked him, saying someone like that couldn't even talk to patients, so he didn't deserve to be a doctor. Just then, a patient was brought in by his son. The son said his father had been having chest pains since morning. The department head began a slow and casual checkup. Tony took one look and knew something was wrong. He instantly diagnosed it as a severe myocardial infarction. If they didn't act fast, the patient's life would be at risk. But the department head didn't believe him. He said no one should make a diagnosis without doing tests. Hearing that, the family assumed Tony was trying to delay the treatment. The son immediately warned Tony to shut his mouth, but Tony stared at the patient and said firmly that without immediate treatment, he wouldn't survive more than 40 minutes. The family got angry and punched Tony to the ground. Even so, Tony stuck to his opinion, but no one listened to him. They took the patient for testing anyway. When the results came back, the head confidently said it was nothing serious, just some minor discomfort, and that the patient could rest a bit and then go home. But Tony ran over, grabbed the report, and looked at it. He immediately pointed out that it was an acute heart attack and his diagnosis had been right. The department head sneered, saying that with all his years in medicine, it was impossible for him to miss something so obvious. Tony quietly replied, "Even doctors can make mistakes."